Welcome to Behavioral Health in the New Normal, a podcast developed by Prestige Community Resources, aimed at bringing healing back to our community through knowledge, expert advice, and positive messaging. The show is a joint venture between the Department of Behavioral Health and Prestige Community Resources, funded by SAMHSA in response to the challenges currently impacting our communities. Hosted by Paul Wells Sr., who uses over 30 years of extensive clinical social work experience to conduct insightful interviews with experts and professionals on a wide range of topics that impact the Washington, D.C. community. From behavioral health crisis to education to financial hardship and anything in between. This show will provide information and insights that will surely make a difference in your life.
Audience, man, am I excited today. We have a powerful woman who's going to share her experiences as a mother, as a business owner, as a life coach. And her name is Nikisha Moore. Welcome, Nikisha Moore.
Hey, Paul, how are you?
Oh man, it's a good day, and I'm really excited about this discussion we're going to have with you. Before we get into it, though, let me just remind everyone that this is a collaboration between Prestige Community Resources and the Department of Behavioral Health with SAMHSA. And we're so proud and thankful that they were able to fund this opportunity to have discussions about how the pandemic has had an impact, but more importantly, how we've overcome in spite of. And so, audience, let me tell you a little bit about Nikisha. She's an alumnus of Howard University. She recently retired from a 20-year career in project and program management. Nikisha is a PMP, CSM, and ITIL V3. And I don't even know what that is, but she's going to tell us. Throughout her tenure, she has worked with the federal government, local government, and several nonprofits in the DMV area. At the young age of 27, Nikisha became an entrepreneur and opened an IT consulting firm. I told you she was powerful, family. In the later years, she began investing in real estate, and which also really benefited her greatly. In the next chapter of her life, it was her heart's desire to simply make a difference in the lives of those who are in need. And in spite of her success, Nikisha's life story has been one of trial and triumph many times over. In fact, in 2018, she became a certified life coach, specializing in spiritual and business life coaching. At this point in her journey, Nikisha hopes to use her life and testimonial to inspire, empower, and motivate others. And as a vehicle to do that, in 2021, she started a company called Empowerment Network, which is a faith-based community organization founded to encourage its members to use their faith to empower their mind, body, spirit, and let's not leave out finances. So Nikisha Moore, welcome to the show. We're so glad to have you. How you feeling again today? I just want to hear. Give me a shout out. You doing good? It's a good day?
Yes, today's a great day. Every day is a great day.
It sure is. And this pandemic, if nothing else, has put us all in a posture of humility and gratitude for every day that we're able to have a conversation. It's a good day. It's a good day. So I'm glad we find you in good health. So I thought we'd start, Sister Nikisha. Tell us a little bit about you, where you grew up, where you went to school. Tell us about your family.
Okay, so I grew up in Baltimore, Maryland. I attended Woodlawn High School. So a shout out to all my warriors out there.
There we go.
I have an amazing family. I have 2 adult children and 1 2-year-old granddaughter who's the absolute love of my life. I have a wonderful family and a wonderful support system on my maternal and paternal side. I'm very grateful for them. We have very good times together. I grew up with both parents. For the most part, my parents did divorce, but for most of my life, I grew up with both parents. I lost my mom in 2012, and my dad is still here, and we're still going strong as a family.
Okay, is he still in Baltimore?
Yes, absolutely. He's in Baltimore.
Okay, and are you in Baltimore or DC at this point?
I live in DC.
Okay, good, good to know.
Yes,
You said you have a granddaughter. What's your grandbaby's name?
Alani,
Alani.
Alani Nathan Bond.
The reason I asked you to say her name is I've met Alani, and she is the most beautiful little girl I've seen, I think, ever. She is adorable.
Yes, lots of fun, lots of
Lots
fun.
of fun, yeah.
Yes,
And so you have two children, the two adult
yes,
children.
yes.
Okay. Now tell us, when did you first hear any um, information about this COVID-19 and the lockdown? When was your first occasion to hear that the virus was here and it had penetrated our life?
I think that the first time I heard about it, the president had was Donald Trump at the time, was making an announcement, and there were some CDC officials, and I happened to be on the phone with one of my cousins. I told her I have lupus,
Hmm.
so I was very curious about the pandemic when I first heard about it and how it would impact me. So I decided, after in talking with her, that I would go to the emergency room and with the symptoms of the pandemic to see what actually would happen.
I see.
And I did that at 1 o'clock in the morning.
Wow, wow.
When I got there, I was surprised. I said that I had symptoms. They would not give me a mask because at that time masks were very scarce.
Hmm.
I waited a very long time to be seen. Everyone else in the emergency room was seen before me. And that was because they did not have a lot of rooms to see uh, potential COVID patients at that time.
Yes.
And rooms had to be purified, air had to be between each person. So that in itself, I think, was a 45-minute process. When I was seen, I was put in a room by myself
Hmm.
with given a telephone. And anyone that came in the room was fully suited.
Yes.
And they told me the doctors would not come in unless they had to examine me further. And they gave me the telephone for them to call me and ask me questions. It was a very lonely
Yeah.
um, process. And so I did a video coming out of that experience that I sent to my family and friends. And I titled it, They're Not Ready, because I realized even in talking to the doctors and nurses at that time that
Hmm.
they had not been fully trained as to how to serve COVID patients, that they still didn't have a whole lot of information. There weren't a lot of rooms that could accommodate COVID patients. So I really knew we were in for a huge ordeal from that experience.
Yeah, yeah, I can imagine. You talked about feeling lonely. And during the several episodes we've had under this topic, many of the persons who've had some exposure, some risk, or even a diagnosis talked about the isolation and the
Yeah.
loneliness that accompanies the entire experience from beginning all the way through recovery. Now, so you were symptomatic early on in the epidemic. Is that what you're telling me? Is
No, I actually wasn't. I just wanted to, because I was an at-risk person with having
high
lupus.
risk?
I
Okay.
wanted to understand what I was up against and what the experience would be like. So, at that point, a lot of the symptoms were just general cold symptoms. And so those were the symptoms I gave. And there actually was a checklist because you would not at that point get tested unless you had a certain number of those symptoms.
Mm.
And it was automated. So when I went in and I said I thought I might have COVID, they actually went through a series of checklists.
I
And
see.
if you did not have enough of those symptoms in the checklist, they would not have tested you.
I see. Now imagine there must have been significant anxiety because you said you went to the emergency room at 1 in the morning. Why 1 o'clock a.m.?
Well, I just know that they're typically a little thinner, in the later hours than during the day.
Mhm.
So I figured that it was, and I didn't want to risk safer time to go.
Okay, okay. Did you get a sense that the medical staff, and I imagine, I think you mentioned that you didn't feel like they were fully prepared, but there
Oh
was,
no, they clearly stated that they weren't. they clearly stated, Ms. Moore, we're still learning about this. We're still getting training
Okay.
ourselves. So we're going to do the best we can. Um, and they said that they only had 5 rooms that they could allocate for COVID patients at that time. So they admitted that they were quite unprepared.
So with that disclaimer right at the beginning, the introduction of patient care, I imagine if you weren't anxious, you might become anxious because there's so much unknown at that time.
Oh,
Uh,
absolutely. And my first thought at that point was to make sure that my village, my circle was okay and informed. And so that is why I took an hour to create a video that I could send around and text to everyone saying, hey, we need to take this seriously. They're not prepared, so you need to, become informed and prepare yourself to stay safe. I realized in the beginning that this was going to really become an ordeal.
yeah. So you didn't meet all of the criteria on that checklist. And so
Right.
therefore they did not move forward with any further testing.
No, they did do the testing because I did meet enough to get tested.
Okay. Okay.
Yeah, I did meet enough to get tested.
And was the
So they
testing
did do
through?
the test.
Mhm. Was it
It
a
was
rapid
extremely
test?
uncomfortable.
Yeah. It was not the rapid test. It was the nasal
Yes,
test.
yes. And
Okay.
they went all the way to the back of the throat. It was very uncomfortable. It was quick, but it was very uncomfortable.
Okay. And how soon after did you obtain the results?
Uh, 7 days at that point.
Okay. So what was that waiting period like for you?
Of course, anytime you're waiting for a diagnosis, it's grueling. So that was a very uncomfortable time. And then you do this intense watching all of the news and on the internet, kind of trying to learn as much as you can. So your anxiety is building as you learn more, and they begin to start tallying the number of losses that we had, even in early on.
Absolutely. And that just exaggerates any anxious ideas that you might have. And
Absolutely.
it is better not really to even pay attention to the news. You made me reflect back during the 90s where HIV testing was being encouraged and promoted and people were going in. And if you recall in the very beginning of that experience, you had to wait 3 to 6 months before your results were available.
Yes.
And then you had to go back and, you went in to get tested, blood drawn, and they orientated you and gave you some information. And then you had to go back. I think it was 3 months, maybe 90 days after. But
Hmm.
that 90-day period in between the test and the results was very, very overwhelming.
Right.
And every symptom that you could imagine, you probably experienced during that 90-day period, just waiting for the exam.
Exactly. Just in anxiety alone. Yes.
Right, right. So the rapid testing is been a critical component, I think, to successful service delivery. It reduces the anxiety. It gives us an immediate result and the ability to treat immediately if necessary. Yeah.
Well, also the rapid testing was a requirement because COVID was could take a life in a week. So
Yeah.
if you were taking 3 months, if this was a 3-month test, it'd be way too late,
That's right.
because the spread was so terrible and
Right.
the life toll,
Yeah.
and the disease moved so quickly that you didn't have 90 days.
Now, prior to self-reporting to the emergency room, did you know anyone who had tested positive or was symptomatic or had expired as a result of the illness?
No, not prior to the emergency room. That was very, very early on,
Mhm.
when they first started going public, that I went to the emergency room, but certainly after that.
So there wasn't a frame of reference that was reliable. There's nothing really to relate to. The facts
Right.
weren't confirmed. The treatment protocols weren't necessarily consistently applied. Um, and there really wasn't a reference. There weren't even others really to talk to about their experience. So I imagine
Absolutely.
that's what encouraged you to record it so that you could
Right.
assist and empower. We're going to talk about your company empowerment,
Yes.
empower other people to make different decisions and to take actions and control over their the experience.
Yes, absolutely. And I continued for about the first 4 weeks of sharing information that I could confirm, with reputable service sources like CDC or doctors that I knew personally, so that my friends and family could stay informed.
Yeah, absolutely. Now, I don't know about you, but when I first started hearing about the pandemic and symptoms that correspond with that and the preventive measures that they were uncertainly promoting, because the messages kept changing. I was
Right.
terrified. I was masked up, gloved up, scared to go out. When I went grocery shopping, I kept the groceries outside and rubbed them down before I brought them in, and
Yes.
just a real exaggerated response to safety. When you got your negative 7 days later, what protocols did you put in place for self to ensure that moving forward you wouldn't contract the disease?
I did the same things that you did. I think most of us were very exaggerated. Even when I got delivery packages, I left them outside the door for 24 hours. I sprayed them down with Lysol before I brought them in. Um, Used gloves everywhere. I did some of the same things. Stayed in
Mhm,
for quite some time.
mhm. And I immediately uh, had concern for family within
Yes.
the house and extended family outside of the home. And was, I kept reminding them, be careful, keep your mask
Right.
on, wash your hands. And they were really getting annoyed at me at some point. Uh, I think I was more preoccupied with safety because working in the medical field, we were seeing people uh, succumbing to the illness real time. We were seeing patients getting sick, and so it was very real to me.
Right.
And some of my family members didn't have that same um, exposure, and so
Right.
some of them were a little careless in the beginning of not really practicing good safety uh, provisions. Did you have anyone in your family who, in the beginning, didn't really get it, and you had to keep reminding them and informing them and educating them?
No, I kept educating, not because my family wasn't getting it. I just wanted to keep it on the forefront because, sometimes when you get away from, watching the news, which, people were definitely doing during that time, it's easy to forget and get a lot, more lax with your safety techniques. So I kept informing people. My biggest concern was my granddaughter, who was only 1 at the time, did not understand the concept of wearing masks. So I was very concerned about her and her safety, um, because she went unmasked, if she was out, because she didn't understand it. She wouldn't keep it on.
That's right. That's right. We did a show, an episode on with a married couple who were having a child during the pandemic. And there are so many nuances that you normally just would take for granted that you had to really pay attention to. And so you're right. A 1 year old is not conscious enough to remind self to keep the mask on.
Right,
And
right.
so everyone else around the baby has to constantly, yeah, wow, I never thought about that. Have you encountered anyone who's gotten sick as a result of the
Oh
virus?
yes,
Mhm.
yes. My brother had COVID.
Oh my goodness.
He did very well with it though. My stepmother had COVID. It took her a long time to get rid of it. And then she had symptoms, different things, different ailments that came up after
Yeah.
she had COVID, and she was in great health prior.
Right.
Um, there are some people that are more distant. Those were the people closest to me, but some of the people that live in my community actually passed with COVID. That was very, very difficult. Very good people. Um, So that was very difficult.
Yeah, same here. I've lost family and dear friends to the illness, and it's, I think I'm not think, I'm confident I'm still grieving their loss because good people, young and a robust life,
Yes,
and unfortunately, um, they succumbed to the illness. Now you talked about stepmom, and there's this term that I've been hearing about long haulers that even though people recover from the acute symptoms, those initial symptoms, they continue to have residual and long-term uh, impact. And
yes,
I guess that's what your mother-in-law is experiencing, your stepmother, I'm sorry.
yes. One of the things that they have said is a long-term impact from having COVID is blood clotting, and that was something that she experienced and is still experiencing, and they're still trying to work with her to resolve the issues of clotting. She's had several clots in her legs, and she never had that problem prior to having COVID.
As a daughter, what kind of emotional support did you feel necessary to provide your dad and your stepmother? What was your role during that whole course of care?
I'm glad you asked that question. My stepmother had a very difficult time. She kept going to the emergency room with anxiety. She was having shortness of breath, and she wasn't sure with having COVID, it made her very nervous.
Hmm.
We really spent time exercising faith. It's something I believe in.
Yeah.
And, I told her she had to keep hope.
Mhm.
I think she was focusing on what if I die, what if I die, and that was kind of her what she woke up to every morning. And I said, you have to change that. So
Mm,
what if I outlive this? What if I outlive that? You've got to ask a different question. You
okay.
got to keep hope. You've got to stay prayerful. You've got to believe that you're going to make it through that. And we went on that journey together. Particularly a spiritual journey together to increase her faith so she could get through it. And that's really when she started to experience less symptoms and then come back with that negative test result.
That's such a reliable response to any devastating diagnosis. And when I think about faith, when
Right.
I think about family, those are
Right.
two important ingredients in the recovery formula. Um,
Yes.
and so I'm just so impressed that you reinforced those two components. You were there consistently, and you reminded her of how to apply faith
Yes.
as she restored her health.
Yes.
Did you ever have any moments of doubt that she would successfully recover?
No, actually, I didn't. I didn't. I believed. Even though we were losing people and we were losing people that I knew, um, I had her taking her temperature every day. We all had the equipment to read our oxygen levels. She gave me those numbers every day, and those results led me to believe that she would be okay.
Yes. Oh, wow, that's powerful. Now, have you had a chance well, I guess you have. You had a chance to visit her, and do you see her
Oh,
face to face?
absolutely, she's doing fine.
That's good news. That's good news. Now, what have you done, or what are you currently doing to stay healthy yourself?
Oh, recently I started walking a mile every day, or I try not to miss days. I can't say I'm out there every day, but I try to be out there most days.
Hmm.
It's been a great, great experience for me. It's just time for me to reflect, just to have some quiet time, to just be mobile after being in so long. And after being, in so long with the pandemic, just to get out and breathe fresh air every day and take those 20 to 30 minutes to yourself to reflect. And, sometimes I just have quiet time. Sometimes I meditate. Sometimes I pray. Sometimes I, goal set, and plan my
Yeah.
next step. So it's
Yeah.
just been very refreshing for me. And through that, in my organization, we want to do a Get Fit DMV movement. just to encourage others to make use of this time that we now can be out of the house and doing something positive. That physical activity definitely affects our overall well-being.
I really want to commit the second half of this discussion to your Empowerment Network agency and your role as a life coach, um, and see what answers and ideas you have to support those who are suffering or emotionally and physically. One thing we know here at Prestige is the request for intake have increased significantly, right? And we know that many people, as a result of this last year experience, have experienced high levels of anxiety, significant depression and isolation, and some other undiagnosed mental health dilemmas have been influenced. And so I'll be interested to hear how you approach it as a life coach. What does your agency do? What strategies have you applied? What models have you referenced to support those who are really struggling emotionally, financially, and spiritually? And so first tell us a little bit about your company, the Empowerment Network. When was it established and what's its vision and mission?
Okay. So we are established in 2021. We actually launched this June. And of course, we are a community services, faith-based organization. Use and our what we're all about is using your faith to empower your mind, body, spirit, and finance. We want to be a very we want to speak faith in a very tangible way,
Mhm.
in a way that maybe many have not been exposed to in the past.
Mhm.
Working with your mind, first of all, healing. You know, we've been through a lot with this pandemic. A lot of people have experienced loss, have experienced, as you said, isolation. And so there's a lot of healing that needs to take place in our community. Um, and so that's one of the things that we want to focus on, is healing the community, healing individuals that come to us for help or to join our organization. And then we want to work with empowered thinking, you know, positive thinking, promoting self-worth, uh, a sense of community and togetherness, that we're not in this fight alone, and that we help each other on this journey. Um, and then, of course, our Get DMV, we want to get people out and moving, congregating together, working on their physical well-being. It will help with many of the illnesses that plague particularly the African American community, like heart disease, uh, um, diabetes, those things. Getting out and getting active will help with any ailment you have, and just taking that quality time to yourself, after, you know, just to regroup after this pandemic, or as we approach the end of this pandemic, hopefully the end.
Can a person present with any faith to your agency and get the support they need?
Oh, absolutely. We're non-denominational.
Okay.
Um, and we just want, as long as you believe, then we're here for you. And even if you don't, and you're just looking, you're trying to find your way, we're still here for you. You know, God, I believe that God is all inclusive, and we want to follow that same spirit.
I like how you've captured and cornered the three important domains in recovery. And what I'm
Yeah.
talking about, the physical health, the spiritual health, and the emotional health.
Yes.
And they tell me, the literature actually suggests that for someone to achieve a good outcome, you really have to hit bullseye in all three areas.
Yes.
And many people will focus more on one. They might work out every day and they might go to church every other day, but they're not addressing their emotional health, or vice versa. They're seeing the therapist, but they never pray. And so
Exactly.
you give instruction on how to cultivate and build all three areas, I think is what I'm hearing. So Ms. Moore, tell me more about the Empowerment Network and how would someone, does someone need a referral into the service? How do people gain access and benefit from the services you provide?
We'll be on an online community. So you can just visit our website, which is www.empowered-network.com, and simply subscribe. That's all it takes.
Okay,
And then we will have people available. We will have a spiritual ministry. So we'll have words of inspiration. We'll have a ministry of music. We will have a prayer request. So we'll have something to meet your spiritual needs, but we also will have services for the community. So if you need help, we have partnered with organizations, local organizations, to provide assistance if you're dealing with homelessness, if you're dealing with addiction, um, whatever your needs are, we will try to meet them or try to connect you with someone who can.
okay.
We also
Uh,
have a community services program, and that is geared to support serving returning citizens, as well as battered women and at-risk youth. And we want to take them through the experience of empowering their mind, body, and spirit as they prepare for the next steps in their life.
Absolutely. So there's a website people can go to, and we're going to make sure we repeat it and announce it again.
Yes.
Is there an interactive aspect to your support? Do they get to talk with someone one-on-one or in a group format?
Oh, yes, yes. So we will be partnering with organizations to host workshops, that life coaching. That's where that kicks in, and we want to help people roadmap to their whatever they define as success. We don't want to define it for them. We want to help them come up with their own definition and then build action steps to accomplishing what they consider success in their life.
Can you share with us what kind of experiences or requests or needs people are presenting with specific to the pandemic? I imagine that this pandemic is prompting people to reach out to resources like such as yours. What kinds of things are you hearing at the front door?
Well, I think that people are in need of emotional support. Um, there are a lot of people dealing with grief. There are a lot of people who are faced with financial issues and having to rethink. Uh, um, Either they've lost their job, maybe rethink their career, rethink other revenue streams, and be creative. Some people need to monetize their hobby until they can find their next career opportunity. So I think that those two areas are big, and of course, I think that the pandemic in its entirety has made a lot of people become more spiritual in their thinking, because it's just something you need, if you're a believer, to get through, difficult and uncertain times.
Oh, absolutely. I definitely know it to be true professionally and personally. Now let's talk a little more about what I call stability factors. And you mentioned something about financial readiness. And as a therapist, I'm real clear on the limits of support we can offer beyond mental health. And that is, if my money's funny and my housing is unstable, it's hard for me as a therapist to penetrate and empower and support the most immediate need. And this financial readiness piece is really critical at this time. So many people have lost jobs and just weren't adequately prepared for a financial crisis such
Absolutely.
as. And I can imagine you're hearing that a lot in the testimonials and the self-reports of clients who are seeking support through your agency.
Yes.
Um, what, how do you respond to somebody saying, I'm not able to pay my rent, I'm not able to get food, and it's causing me to be, psychiatrically compromised?
I think the first thing is to really help an individual that comes with those needs, find services and support that will assist them where they are right then. I think that when people come with tangible help, you can't, giving them a motivational speech is not what they need at that time. They need real assistance. And so that's one of the things we focus on, just trying to get them stable.
Yeah, I definitely appreciate the fact that there's a case management function ingrained in your network. And so when those immediate needs and or long-lasting needs are
Right.
visible and clearly stated, then you connect them with appropriate resources.
Yes.
That's extraordinary. Um, a life coach. What is a life coach?
A life coach is someone who asks great questions. Really, my goal with life coaching is to get to understand my client, ask
Mhm.
them great questions about where they are and where they desire to go or be in life, and then to really work with them to help them roadmap what that trail looks like to their success. Whether that success be in the area of their mental wellness, their spiritual wellness, their financial wellness, um, their physical wellness, whatever their goals are, is really to take them one at a time and help them roadmap what it looks like to achieving success.
What is the preparation and training requirements to become a life coach?
Um, there are life coach certifications. A lot of different companies offer them. Um, I chose to go with IPEC, and they had a very rigorous training. I think that life also prepared me to do life coaching because uh, I and my network of family and friends have had to coach through getting through difficult times in my own life. And I think that those experiences help me to help others.
Well, I was going to ask you something that I sense, and just based on my work doing this work so many years, I believe. Oh, let me say it a different way. Since you're a woman of faith, I don't believe in luck and chance. I believe in divine intervention and direction. And I don't believe necessarily that people choose this type of work, social work, life coach, peer
Right.
special. I believe we're chosen to it by divine right and privilege, but also through a set of experiences. And I was going to ask you because, interesting enough, you were a business owner, IT specialist, entrepreneur, did some real estate, and some of those personality characteristics are different than someone who would want to jump into the human service field. So tell me, where did this motivation and passion come from? Can you share a little bit with us?
Sure. Well, I've always loved people. And I chose IT because I could support my children off of that. So it's not, I've never been a geek, never been a lover of technology,
Hmm.
just knew that it was a stable income to have. Um, I've always loved people, always cared about people. This ministry, though, I will say, uh, God chose me for it. Um, I think I ran away from this calling for a long time, which is why I had so many other experiences with other business endeavors. I think in 2010, someone told me, you'll be called to minister, you're going to become a minister. And I'm like, you're absolutely crazy. That is the absolute last thing that I would ever do in life. But you have a set of circumstances. And for me, having lupus and my health progressing, it changed everything for me. It changed my world. It changed my outlook. And then I came to understand why I was called into ministry and helping others because I went through a lot myself. And
Yeah,
you can have just one circumstance. It could be health. It could be the loss of a loved one that just changes your entire life, your direction, your purpose. And that's what happened for me.
yeah.
And so now I'm fully committed to this ministry, and making a difference in my community, and helping people because people help me.
Yeah, you're fully committed. You're fully committed. Thank you for sharing. And I appreciate the journey that you described.
Yes,
Um, and I know the participants in your program are going to be the beneficiaries of such pure, sincere, God-driven support, commitment, commitment to the community, commitment to people. I tell you, if you've ever been a patient or if you've ever been in a vulnerable circumstance, you can really appreciate the need. And,
Yes,
when you describe the experience in the hospital, whenever you've been the patient, you know the difference between good care and not so good care. Right? And
absolutely.
I believe that based on what I'm hearing from you, there's a standard of excellence, sensitivity that that's always going to coexist in all of the activities that your company engages in. Am I right?
Exactly. Yes. And not just that, I was blessed to have a amazing team because there's no way you can do this body of work by yourself. And they are equally as committed. They have been on their own individual journeys in life and been through some things. They're very down to earth people. We're all humbled by our experiences. We're all committed to making a difference. And we all had really great support systems. So we know how to support our community. And it's just important at this stage in all of our lives, the entire team to make a difference.
Yeah. So what kind of support, orientation, and training do you provide your team? What are some of the expectations that you have of them as they perform and promote good health?
Um, the expectations I have my team, I think that it's a little different for me. What I think, well, what I know I did was moved to do was pick a team that I knew already had been equipped. I think that spiritually, there needed to be a connection as well as life journey. So what we did in our interviewing process is really talk about the journey, and what was gained from the journey, from those four areas: mind, body, spirit, and finances. A lot of the people on the team have had to start all over for one reason or another in their lives. So I think that you can always get great qualifications, and my team does come with great qualifications. But to serve, you have to have great experiences. You
Ooh.
have to have a relationship uh, um, for this group with God and understand what the mission is and be fully committed to that. And that was the most important thing to me because I think that that's what will benefit our consumers the most.
Nice. I guess you want to work with other chosen people,
Yes,
people who are also
absolutely.
chosen. Yeah, I appreciate that. What message of hope can you provide us at this time, or for anyone who's suffering illness within their own body, or family member or coworker, and they're faced with the same uncertainty and anxiety that you were greeted with in the beginning when you went into the emergency room? What would you say to someone who's, recently diagnosed, or we have a pending diagnosis is kind of sitting out there?
The first thing I say is stay positive and stay prayerful. Understand that life is a journey of ups and downs. And as long as you have breath, there's an opportunity to make each day and every day a great day. And it's really about the power of perception. I used to say to my kids all the time, you can take someone who loses their job and they can either see it as an opportunity to do everything they've ever wanted to do in life, or they can perceive it as the worst thing, and decide maybe to jump off a bridge or something like that. But that power is within you of how you perceive any facet of your life, the good and the bad, and how you perceive it is how you control your destiny.
That's right. That's right. Now, in closing, I wanted to talk a little bit about this vaccine, and wanted to get your thoughts on that. And I'm sure people are seeking the support from you and your agency with mixed feelings. And in the African American
Yes.
community, we know there's still a lot of questions. What are your thoughts about the vaccine, and do you encourage people through your network to become vaccinated?
Yes, I do. I am fully vaccinated. I fought very vigorously before they called me. I called them about getting vaccinated. I went there and stood in line with no appointment, just determined to get it. Um, I think first with the vaccination, people need to understand that it does not keep you from getting COVID, but it keeps you from the symptoms that would cause you to pass because of COVID. And for me, that was good enough. I think it's a different kind of worry to once you're vaccinated, of getting COVID, when it's something that you feel like you will not die from. So I know that we've had problems in the African American community being tested and given drugs in in our history, being used as guinea pigs to test out certain things. And I know that because we have that history, more African Americans are fearful of getting vaccinated. I definitely understand that. I've also heard some people say they came up with a vaccination too fast. But I caution those people to think about, well, what is the time frame for vaccination? I don't know, but I don't know that people that feel that way know either. In history, when there has been a crisis, I don't know how fast they come up with a vaccination, but I'm glad that in this case, they did come up with one, and did come up with one relatively quickly. So I believe in getting vaccinated because I believe in being safe. And I don't want to lose any more people.
That's right. That's right. Thank you for that. Those words of encouragement and instruction.
Yeah,
And it's obvious you and the Parliament Network are promoting, encouraging everyone to be safe. And part of
yeah,
the safety plan would include vaccination.
yes.
Okay. Ms. Moore, we've appreciated today's discussion. We definitely want to honor your network, empowered network company, and we salute you for your community service and all that you're doing to give back to others who might be in a vulnerable position, whether it's temporary or long term. And I'm encouraged by the hope that you offer those who penetrate and access your website to achieve some healing and some stability. Is there anything else you'd like to say in closing to the audience related to the pandemic and just recovery?
Um, Other than stay hopeful and prayerful, no. I just do want to thank you, Paul, for this opportunity. It's been wonderful sharing with you. And I hope that someone will be blessed by this conversation today.
Nikisha Moore, I know everyone's going to be interested in knowing, people are going to want to reach out to you. What's the best way to make contact with you and or your organization?
I think the easiest way would be to visit our website. All of our contact information is there. And again, that's www.empowered-network.com.
Okay. I'm sure as a result of this podcast, people are going to reach out to you to get more information and maybe to even enroll into your program. Ms.
That
Moore,
would be
thank you.
great.
And thank you so much for your time. And for the audience, I want to remind you that Prestige Community Resources is working in conjunction with the Department of Behavioral Health to offer the series of podcasts related to overcoming the pandemic. If you want more information, you can go to our website, prestigecommunityresources.org, I'm sorry. And there's a menu of that you can access to get more information about the agency. Until next time, please be safe and be well.